Okie dokie. So, welcome. It's Therapy Thursday. My guest tonight is Miss Jessica Penn. And before we get started, just a small introduction about Therapy Thursday and party and have some fun. Get on the dance floor. Get on the dance floor. Get on the dance floor. I know you want a good vibe. Get on the dance floor. Get on the dance floor. Party and have some. Okay, welcome to the couch, Miss Jessica Penn. And you're joining us from out west, correct? You're in California?
Yeah, I'm in
Okay.
San Francisco.
I'm so excited that you are on this live with me discussing this very sensitive personal topic for so many people that just does not get discussed enough. So thank you for being here. Before we get started, I just wanted to share a little information about you so that folks know who you are. I have that you're a medical researcher and an influencer, and that you advocate for better coverage of vulvar anatomy in medical literature and better patient education. You have a background in biomedical engineering from Washington University. And so from here, we go into basically what brought you on tonight. I somehow ran across your Instagram page. I can't remember how. I don't know if you liked something or we liked something in common, but I went on your page and I was like, whoa, I have to talk to this lady. So I see that at the age of 18, you underwent a severely botched labiaplasty. Those are your words. You said by the end of college, that you've done enough research into what happened to you to conclude systemic neglect of vulvar anatomy and female sexual function, as well as lack of training standards for labiaplasty, were the main causes. So you decided to find a way to stand up for yourself and prevent what happened to you from happening to other patients. You mentioned that you suffered trauma, and I'm sure, and I want you to, if you're comfortable, I want you to talk about that, the trauma that occurred after you underwent that procedure and how long it took for you to basically to recuperate from that. But so I'll get back to that first. My first question for you is this: why vulva and not vagina? What's the difference between the two for the people who are watching or will watch later? And so as you explain, I just want to share a shot here, which I don't know, this may not be to your liking, because I know that you've been working with different medical specialists and publishers and textbook companies on depicting the vulva the correct, proper way. So talk to us about that, vulva versus vagina.
So the vagina is just the cavity, and the vulva is everything that you see externally, including the clitoris.
Okay, guys, so let's see. Here we have the vulva. This is everything that you see depicted here. What do you think about this photograph or this picture? Do you like it? Do you give it a thumbs up or a thumbs down?
I think it's not bad. I tend to think, so according to the Gynodiversity Project, which is a really helpful resource for any women who want to learn about the normal range of female genital anatomy, the average clitoral hood is 34% of the length from the top of the clitoral hood to the forechet, or to the very bottom, right? And so I tend to think that whatever's shown in medical literature should be the average, but this is close enough that it's not a huge problem. Like sometimes medical illustrations show the clitoris much smaller than it really is, and that kind of disturbs me. This is close, but you know, the pattern is that the clitoris tends to be minimized and the vaginal opening tends to be exaggerated. And you do see that here a little, you know, it's not terrible.
Yes. Okay. So I will remove Exhibit A. So talk to us about your personal story behind the advocacy that you do now for women for our vulvas and our educational knowledge? What happened to you at the age of 18?
Okay, so it actually started when I was 17, and it started largely because the only term I was ever taught for female genitals was vagina. And I understood that the vagina was fundamentally a cavity, that my genitals were fundamentally internal. That's how I conceptualized them. And so, and I never really thought too much about what was on the outside, but there was a lot of sort of confusion and ignorance there. And then, because I was reading women's magazines and because people were sort of talking about the clitoris at school, I needed to find out what that was. And I couldn't find mine. I didn't know what it was. So I was Googling, and that's when I came across the terms vulva and labia minora for the first time at almost 18 years old. And so I was searching those terms, trying to learn, and that's how I stumbled upon labiaplasty surgeons' websites. I stumbled upon before and after photos. I looked like the before photos. So that was the first thing that led me to believe I might need surgery.
What do you mean by you looked like the before photos?
I looked like the women did before their surgeries, before the labiaplasty. The implication was that the before photos were ugly or abnormal, and I looked like the before photos, not the after photos, which,
So are you suggesting that your labia minora or the labia majora was not?
I had my labia minora so I actually measured them. They were about 2.5 centimeters long, according to my measurement. My doctor claims they were longer, but I think he lies. He lies about doing things that he did.
Gotcha.
Anyway, at the time, I couldn't find. So they stuck out, and I thought they weren't supposed to. And I read online and in peer-reviewed medical literature that protruding labia minora are considered unfeminine and embarrassing.
Oh my gosh. You read that in medical literature?
Yes, and it is in recent medical literature to this day. It is in, recently published articles on Medscape and Up to Date. It is in major medical textbooks like Essentials of Plastic Surgery. I guess you see that particular statement more in plastic surgery literature. I don't think they've said it so much in OBGYN literature. I'd have to go back and check. Right. But they do repeatedly publish also that labial hypertrophy may be caused by aging and excess androgens. There is no evidence for that. Normative studies have only shown either no correlation between age and labia minora size after puberty or an inverse correlation, yet they advertise these procedures as rejuvenation. So for teenagers exposed to these messages, they're thinking, oh gosh, I am unfeminine, I have an embarrassing problem, and I look old. And that's how I was feeling. And I think
wow.
a lot of
at the time, at the age of 17, that your labia was overgrown, that it was too long or too extensive.
Yeah, even yesterday even yesterday when I was going over Up to Date, which is a website that doctors use to stay up to date on new medical information, an article which was written by OBGYNs actually on Up to Date about labiaplasty did say that they referenced that normal labia minora should be under 3 to 4 centimeters. I think that that's too restrictive a range. I think like anything under 5 is pretty normal.
Yeah.
And I think that there's just a lot of language that I think is shaming, and for young women who have been exposed to that and have meanwhile not seen what vulvas look like. I just had no exposure to what vulvas look like. Sorry.
That's okay. I want to pull up this picture again so that people who began watching after we started So here, so people most commonly refer to the anatomy, the part of the vulva, the external part, as the lips. So these are commonly called the lips. The thick or the bigger portion, the external portion of the vulva, is called the labia majora. Um, so as you're hearing these terms, guys, this is what we're talking about. When you peel back the external labia, there's another set of what people commonly call, again, lips. Um, they are actually identified as the labia minora. This is the area that Miss Jessica Penn is referencing with regard to her personal situation, correct? You said that
Yeah.
that yours was overgrown or too long or too big, or
My labia minora stuck out past my labia majora, and that's actually extremely common. In fact, sorry, 43% of women have labia minora that stick out past their labia majora. And 69% of women have labia minora that do show, like either by going past the labia majora or just, showing slightly between the labia majora. It's very normal.
right.
Yeah.
Okay.
And 73% have something showing, like either the clitoral hood or labia minora or something. Only 27% have just a slit and nothing showing at all.
Yeah.
Or I shouldn't say slit, but just like a fold,
Right. Right. No, I understand. And so you underwent the procedure at the age of 18?
It was within days of my 18th birthday.
Okay.
I went to a very reputable OBGYN who has since been president of the Texas Medical Association and president of the Dallas County Medical Society, and is considered such a great doctor, and has even been in Time magazine for all the work he's done to help women because he delivered the first uterus transplant baby in the US.
Wow. And that was your surgeon. That was your doctor.
Yeah. So, there has to be something very wrong, or at least occurred to me that there had to be something very wrong for someone who is considered such a great doctor to screw up as badly as he did with me.
Now, what do you mean he screwed up? Is it because he felt that you were a candidate for this procedure, and he should have recognized or known better?
At the very least, I should have been informed. I was really, really uninformed. I was under the impression that there were no risks to my sexual function at all.
Okay.
I had no idea what was normal. I wasn't given any information on that.
Wow.
He completely removed my labia minora, and he did a clitoral hood reduction without my consent. So he did a separate surgery without my consent. And one thing that I really like to emphasize is that clitoral hood reductions are fundamentally clitoral surgeries, because most of the clitoral hood is basically just the skin of the clitoris. Like, the body or shaft of the clitoris is right beneath. And a lot of people don't realize that because they conceptualize the clitoris as just the glans or the head, like just the tip that they can see. But the body is under the clitoral hood.
Right.
And so the nerves of the clitoris are pretty superficial beneath the skin. And so if you're operating on that skin and you cut too deep, you can injure the nerves. And I think a lot of doctors don't consider that. I've noticed some do, and some recommend against clitoral hood reductions, which I think is great. And others just emphasize that you need to stay very, very superficial when doing them. I don't think my doctor thought about it at all. I don't think he had any idea what he was doing. He was never trained to do labiaplasty.
Oh my gosh.
He had done 2 before me, both on doctors' family members. That's why a lot of people think that, I should have done my research, and it's my fault because I didn't do my research. But my doctor was chosen by my plastic.
You were still a child.
Yeah, my doctor was chosen by my plastic surgeon father. And he had also been chosen by 2 other physicians for their family members. So I think that there's a lot of misunderstanding about what qualifies someone to do these surgeries. and who was going to be safe and who's not going to be safe.
Gotcha. Okay. So you underwent the surgery, you had the procedure. And so, of course, I'm sure you were bandaged after the procedure. How many days until you saw your vulva, until you could actually visualize and see your labia majora and the damage that was done?
Honestly, I don't remember. This is so long ago. I'm 34, and this is 16 years ago.
Mhm. Do you remember looking and saying, "Oh my gosh, this is not what I asked for"?
So I didn't, from my perspective, I wanted to be normal, and I trusted my doctor to just like make me normal. And I remember being surprised that he removed so much, because I didn't think that he was going to remove so much, but I just thought that he must know what he was doing. And I didn't know the difference between the labia minora and the clitoral hood at that point. Even after trying to educate myself about the anatomy, I hadn't noticed that. I didn't know the difference. I never found my clitoris. Like, after all of that effort, I couldn't find it, which is embarrassing. So all I knew after my surgery, I didn't know that anything looked abnormal because I didn't have any frame of reference. I didn't watch porn. I didn't know. And people always blame porn for ignorance, but when I started watching porn, that's when I really started realizing how fucked up I got and how I hadn't needed surgery. So I tend to defend porn, at least in that regard. Tend to think there are a lot of different types of vulvas.
So I don't want this to sound like a silly question, but you mentioned that you could not find your clitoris. So that was when you were 18, you're saying?
Yeah.
Okay.
So I didn't know what was wrong. I knew that I had lost external sensation, but that's all I knew. And I didn't, so I had very limited sexual experience. I had been eaten out one time. I was like fooling around, like I had been fingered, and all I knew was that I didn't get, I couldn't get stimulation from external touching the way that I could before, but I didn't really understand. And I remember being sad, but I just blamed myself. At one point later after my surgery, I had a boyfriend who I was having sex with, and he asked me, was I having orgasms? And I told him that I didn't think that I could because of a surgery that I had. So I knew enough to tell him that, I said, I don't think I can because I had this surgery, but I still thought it was my fault. It took a long time for me to realize that something was really done wrong and it wasn't my fault. It's hard to explain, but if you look at a lot of patient stories, a lot of women who have these surgeries and have bad outcomes, they do think it's their fault. And they tend to think, oh, I didn't do my research, or I should have known better, and so I think that was sort of normal.
I just don't know how any 17-year-old or 18-year-old could know what to expect or what they're asking for. So I'm 16 years later, but obviously not your fault. It's mind-boggling to me that surgeon, it sounds like he did not sit you down and say, hey, let's take a look with a chaperone in the room. Let's take a look at your vagina and what you're seeing and what your concerns are, and let's identify the anatomy here to answer any questions you may have had.
Yeah, I guess, one problem is, so I had read that it was recommended to tell all patients that they were normal, even if they were unusual. And I had been to a previous female OBGYN, and she had tried to tell me that I was normal. And I asked her what percentile I was in, because that's the data I wanted. Like all this data that I just gave out earlier, that's what I wanted as a kid because I was kind of a nerd and I needed numbers.
Gotcha.
And she wouldn't tell me. And I got the impression that she was hiding information from me that was bad. And because I was reading all this really derogatory stuff online, like that my anatomy was unfeminine and embarrassing. And some of it even was scary to me, like the idea that they would cause pain during sex, like caused me to worry, oh no, I'm going to have pain when I have sex. Like I believed that. And so I claimed that I had pain when I rode my bike, and that was a lie. And so that was another reason why I thought it was my fault what happened. But, you know, I never would have had surgery if I thought there was any risk to my sexual function.
So Jessica, did this surgeon, he removed your clitoris? Did he removed, you said, the labia minora as well as the hood of your clitoris? Did he remove the body also?
No.
Did he excise?
So basically what I've been trying to get people to realize is that you can damage the nerves of the clitoris, but in clitoral hood reductions, because so in my study, so I don't know if you've seen my study, but in my study you can see, and in the illustrations that I post on my Instagram, you can see that the dorsal nerves of the clitoris are just under the clitoral hood,
right,
like just under the skin. And so if you're operating on that skin, you can injure the nerves. And I think he just,
okay, I see.
well, he injured my clitoris. He didn't, it's still there.
Yes, gotcha. So when you said you could not find it previously, it's just because you didn't understand the anatomy that you were, you're looking at. Yeah.
No, but you know what? I come across this a lot. That's why I wrote, like previously I was on Quora, long story, it's just a question and answer website, and I wrote instructions for how to find the clitoris for people who have trouble.
Good for you, because a lot of women do not know. Before preparing for tonight's show, I was online looking to see, okay, what's out there when you Google pictures of the vagina, pictures of the vulva, you know. And I ran across pictures of women sitting and using mirrors to try to see themselves. And that's a great thing, because there once was a time when I'm older than you. And there was a time when older women had no idea what their anatomy, what their genitalia looked like. I remember as a younger girl looking in a mirror to see myself, you know, and talking to my mother about my anatomy and my genitalia. So this is really powerful that you're empowering women to take control and to understand their bodies, because this is really a factor behind why a lot of women are not sexually satisfied, is that they don't understand themselves. They don't know what's in between their legs. And they don't know that this area, the entire area can be sensitive depending on the person. You know, it can respond to touch and, you know, to tongues and fingers and, you know, all these things very well. But especially in the area that you were describing with the labia minora, has a lot of sensitivity and nerves are there. And I saw something you posted previously that you mentioned, I guess it was a textbook, did not depict, but didn't illustrate or describe the nerves, the appearance, or the fact that nerves are there in that area, and that's a very sensitive area.
Yeah, they tend to. So until 2019, the course of the dorsal nerves in the clitoris, which is where they got injured in my case, was not shown in OB/GYN literature or described. Like it just was missing. There were kind of two exceptions, but very recent and not good. But in general, it was basically missing. And so I've worked to get these textbooks updated so that they show and describe the anatomy. And so they show cross sections, which I think also help.
Mm-hmm.
And as for the labia minora, their anatomy and function almost never gets talked about.
Right.
They tend to be approached as non-functional and as a hindrance. But I have focused on the clitoris because I think that that's like the main thing. And I just decided I have to pick one thing that I can change.
And the clitoris is important. It is very essential to not leave out the clitoris. We have to discuss the yes, because oftentimes a lot of women climax or experience orgasms because of stimulation to that area of the vulva. So absolutely agree.
Yeah, it's the most important organ to female sexual response.
Yes. So I'm looking at some of your posts. You mentioned normalizing covering clitoral anatomy. You mentioned, I mean, so people, if you haven't visited Miss Penn's page, I have it here. It's Jessica underscore Ann, ANN underscore Penn, PIN. And so you have met the burden of proof. You post samples, examples, and excerpts from different um, textbooks and journals showing what they're not showing. And I have to admit, as a medical student, I really don't remember learning a whole lot about the female genitalia. I don't remember that in anatomy. I don't remember really delving into the details of the importance and the nerve endings and
Yeah, so it's not well covered. So one thing that I've done is I've counted the number of words devoted to the clitoris versus devoted to the penis. I did this in Gray's Surgical Anatomy and also on Medscape. And Medscape has asked me to stop complaining about them because they think it's unfair because they've agreed to make changes. But that's my best example because anyone can log in easily. And so they have 57 times as many words describing the penis as describing the clitoris, and they don't provide any detailed anatomy for the clitoris at all. So 57 times. Like, even if you want to say, yes, the penis has more parts and more functions, okay, great. But like 57 times,
yeah.
that doesn't make any sense.
What effect or what result do you think that has on women when they see that their anatomy is not important? When they see that their anatomy is not being talked about or discussed, or what effects do you think that has had on us as women and our
Well, I
response?
think it sort of parallels issues with the orgasm gap. What I see mainly is that women just sort of accept it. Like, one thing that's been very frustrating is how a lot of female doctors just kind of accept that this is right and fair, and they'll even defend it just because that's the way it is, and they have so much belief in their education that it's sort of offensive to them to suggest that there's something wrong. But it's weird. There's sort of this pervasive attitude that male sexual pleasure and orgasm is more important, or that female sexual response and orgasm is primarily dependent on like psychosocial factors, relationship factors, emotions, hormones. Hormones does affect it, and like all these things, they do affect sexual dysfunction, but the anatomy really gets neglected when it comes to women. On Up to Date the other day, I'm forgetting the exact numbers, but penis and penile got mentioned over 50 times in an article on managing male sexual dysfunction. Clitoris got mentioned once, or maybe clitoris and clitoral got mentioned twice total in that article. It's just really bizarre. The approach to female sexual dysfunction is totally different. It tends to lack anatomic basis. For example, on Medscape, in the articles on female sexual dysfunction, they do not discuss any anatomic basis, but in the article on male sexual dysfunction, they do. There's just this dichotomy in how men and women are approached. I'm not trying to exclude anyone with my language, by the way. But there's a dichotomy in how penises versus vulvas are approached. And this is a really bad thing for trans men as well. I actually read some disturbing things about how trans men's gender reassignment surgery goes. Like, sometimes they'll, at least according to Up to Date, which is supposed to be up to date,
Right.
We talked about burying the clitoris to make room for the pseudophallus, or the
Right.
they're gonna bury what gives them sexual pleasure to put
They
a
take away their ability to experience pleasure in surgeries.
I mean, it wouldn't have taken away the ability, but it definitely would have reduced it. I mean, I can't imagine people having that done.
Yeah. Yeah. So, and this is why I wanted us to talk about this, because there are so many women who don't understand. I don't want to say the power of the pussy. That's so cliche. That's something that has been said in songs, and
Yeah, and that's
it's
something different, because that's about holding power over men, and
something
there needs
different.
to be more focus on the power it has for women.
Yes, exactly. And that's where I was going with it, is that we have minimized our, some of us have minimized our own self-interest and who we are, um, and our makeup and our anatomy, and not understanding the composition and what happens there and all the important things that take place there. I think a lot of women have not been educated or taught, or shown. They haven't had someone to talk to them about their anatomy.
Yeah, there's so much taboo around it. It's crazy. And
Hmm.
it all has to do with, in my opinion, the suppression of female sexuality in society. Like this idea that women historically weren't supposed to be sexual, we were just supposed to be reproductive. And there's a lot of history there. There's a lot of history of shaming women for being
Right.
too sexual. These genital cosmetic surgeries pretty much started as treatment for nymphomania and like excess female desire and masturbation, like removing the labia minora and sometimes the clitoris was considered treatment
Yeah.
for
So
that.
looking at something you posted, it's a quote from a Dr. Anuja Vyas, an OB-GYN, obstetrician gynecologist. Quote, doctors often treat the vulva like a small Midwestern town that you drive through without noticing it. Close quotes. So sad. So let's switch gears a little bit. I'd like to know, after your surgery and once you were able to understand exactly what had happened to you, how old were you at that point in time once you realized what you'd actually gone through?
Honestly, there was sort of it was sort of a slow process.
Right. That's what I'm thinking. Were you in your
You know,
20s?
like by 2000, by 2006, I knew that my surgery, or I believed my surgery had made it so I wasn't able to orgasm.
Gotcha.
By 2005, I suspected it and I was Googling and I was trying to understand, but it was hard to figure out. So
Wow.
it wasn't until 2007 that I understood that my doctor shouldn't have done what he did to me, because that's when I started watching porn and nobody looked how I looked. Nobody has their labia minora completely amputated in porn. You know, everyone talks about how they have tiny labia, but I was like, they have labia. I don't. Anyway, and I saw women who looked like I did before my surgery, and I was like, hold up, I was fine.
Yeah.
Because one thing is I just kept one thing I kept telling myself was I really needed that surgery. And so it's just too bad what happened because I really needed it. But then I realized I didn't. And then in 2008, that's when I first told my parents. The first thing my mom said to me was, I never thought you should have had that surgery. She said, don't involve your dad.
What did you tell your parents? What did you tell them actually?
That my labia minora had been completely removed and that they shouldn't have been, and that I had lost sensation, I think, and I didn't know why.
Gotcha. And you
I
said your father is a plastic surgeon, yes?
Yeah, and so he initially didn't believe me and thought I must be mistaken. And so one thing was there was a lot of, well, I don't know, just it was a confusing process. The OBGYN I was seeing at the time was the partner of my original surgeon. She reassured me that I looked normal, and she said, I mean, it's so hard. I'd have to go back and I'd have to check my emails from back then, but she said I looked normal and that my surgery could not have affected my sexual function, and she said I just needed to relax. And so I stopped seeing her after that. I went to a new OBGYN the next year, and she told me I just needed to fall in love.
Oh gosh.
But she at least was horrified that my labia minora had been removed, and she was worried about me having discomfort, and so she prescribed estrogen cream, which I remember I wasn't comfortable taking.
Oh my gosh.
But yeah, and the funny thing is that she said she was horrified and she expressed sympathy, but she never told me I could report my doctor. And later I went to her and I said, Dr. Farrow, next time you encounter someone like me, can you please tell them that they can report the doctor to the Texas Medical Board? And she said, that's none of my business.
Did
and I
you
said,
report the surgeon? Did you end up reporting him?
No, I was scared. So it took me a really long time to find out that I could report him. And I guess I have a problem where I always rely on my dad for everything and think that he has all the answers. So, I talked to my dad about reporting, and my dad thought that I shouldn't. And he thought that it would be smarter and more fair to my doctor to confront him directly. So I wrote him a letter, and it was really hard for me to write, and so I put it off. And I didn't write it until after I graduated from college. So that was the spring of 2010. And my doctor responded. It took him 6 months, I think, to respond. And I just kept waiting for him to respond. And I thought that would give me the sense of peace or whatever that I needed. I expected an apology, and I expected an explanation. And I also wanted help changing things so it wouldn't happen to other people, because, I kind of had to think to myself, what do I want? What outcome do I want? And what I wanted acknowledgement of what happened to me, and I wanted some kind of apology. And I wanted something done to protect other women, because I had, because people make mistakes, and clearly there's been this systemic problem where it's pretty much the norm for doctors to do surgeries on anatomy they don't know. I mean, it's crazy, but it's like, if you're working in a system where that's the norm, it's not all on you, So I tried to frame it in my letters like not really his fault, and ask him to help me change it. And he responded by blaming me for my surgery. And sorry?
He blamed you?
I mean, I have a copy of the letter. I might put it on my Instagram, actually.
Wow.
He said, I was just giving you what you wanted. You insisted on this surgery. But the thing is that I consented to excision of redundant labia minora, and he completely removed them. That is not what I consented to. It's not a reasonable result based on what I consented to. He did a clitoral hood reduction without my consent. He claims that he didn't. What he has said since then, one of his colleagues who examined me tried confronting him. So, and another thing I did is I said, I told, I was calling his office and I was saying, I will come back in and I will show you what you did, because if you don't remember, and he wouldn't see me. And his colleague examined me and called him and said, hey, you did this. There are scars. You can see what was done. And he said that I must have had a second surgery. And so then my dad confronted him, and he said, well, maybe she did it to herself.
That is just foul. That's awful.
The thing that's hard is how he is seen as such a good doctor. And the other thing is, he said he stayed far away from my frenulum, but my frenulum is cut. And again, this is the kind of thing that you can see. It's not up for debate. This isn't like he said, she said. This isn't like you know, it's not like, oh, like sexual assault accusations are very, very serious, but like in some of those cases, we cannot establish proof. In this case, the proof is walking around with me every single day. And he's just lying and people believe him. Or I hope that a lot of people don't believe him. But sometimes it feels like they must, because how are the same OBGYNs still working with him? And how is he still considered this great doctor? It's just crazy. And so maybe, I don't know, it's weird.
Practicing as a surgeon,
he's still practicing. He's still highly respected. Yeah.
Well, I'm sorry that happened to you. I'd like to know if did you seek mental health treatment after you realized exactly?
I did. So I guess it was one of those things that I felt really, really uncomfortable talking about. And it was extremely scary for me to talk about. So yeah, so I didn't. I also hadn't had very good luck with therapists and psychiatrists, but I actually was seeing a psychiatrist pretty regularly in college because I took Adderall. Anyway, because he was an older man, I think I didn't feel comfortable telling him. But you know, so you asked like when I fully. So basically, what happened to me didn't get confirmed until February 2011. I didn't get like officially confirmed by a doctor. Even though like I understood it before then and I was saying what happened, but I was actually, I was a little confused and I was saying like maybe this, maybe that, I don't know. Like one thing that was hard is I couldn't find good illustrations or descriptions of the dorsal nerves. And I remember feeling very insecure saying like, this is what I think got hurt, because I didn't want to be crazy. And I also kept thinking that, I also kept hoping that it was fixable. So that was another thing. I was a little obsessed with like, what could be done to fix it? And, you know, having a doctor confirm what happened to me and tell me that she didn't think it could be fixed was like hard. And so that coupled with the letter back from my doctor, and also just honestly, I had some issues like with my mom telling me I was making mountains out of molehills, and I had some stuff going on where I didn't feel supported, and so I attempted suicide. And after that, that's when I finally talked to my psychiatrist. Because at that point it was like I needed to talk to my psychiatrist. And what he said is I wasn't dealing with it well because I hadn't gotten over a previous trauma from when I was 15. And so that was really invalidating.
Associated that with the trauma from age 15, basically.
I'm sorry?
He associated what you were going through with the previous trauma as opposed to just...
He basically was telling me I was overreacting because I never got over a previous thing.
Yeah, he blamed it on your previous situation that had nothing to do with your botched surgery, and instead of helping you process that part of your life.
Yeah, I kind of wish I could go back in time and confront him and say, hey, what if this happened to your penis? Because I think he wasn't empathizing right or something.
Wow. Well, I thank you for sharing your story.
Yeah, I saw a lot of therapists. I actually did want to comment on that a little. I don't know if we have time.
Yeah, sure. Go ahead. If you feel comfortable sharing, no problem.
Basically, I think that, you know, talking like this whole topic is very taboo, you know, not just because I'm talking about my genitals, but also because I think that like medical trauma is taboo. Like, I think it's taboo to talk about getting harmed by a doctor because people have so much trust in doctors. And it's, I think, unsettling to people's worldview to think, oh, I might get hurt by my doctor, or maybe I can't trust my doctor. You know, I think that's unsettling, and I think that makes people uncomfortable on top of, you know, talking about genitals making people feel uncomfortable. And so my experience trying to get help from therapists was very frustrating, because my story would make them uncomfortable. And I also just had a really hard time being understood, because I always had this thing where I believed that I needed to be able to stop it from happening to other people, and no one I talked to understood why I felt that way. You know, I explained to that first psychiatrist that I needed to be able to make the meaning of what happened to me positive, and he said, "You can't make it positive." And I remember getting so upset because I felt like I needed to. But, and the funny thing is, I mean, I don't know if this is relevant, but I think that in trauma therapy, there needs to be more focus on resilience. And there is actually research on resilience that shows that people who try and make positive meaning from their trauma and try and go out and make a difference and help others, like, they are more resilient, and it helps them.
I would agree with that.
Yeah. Yeah, and also, like, just now you said that you were sorry that this happened to me, and that's a really big deal too, because for years nobody said that.
Oh gosh.
Yeah. So.
And so yeah, so it feels like your situation was never validated. They, in some instances, made you the reason. The whole thing has been blamed on you, or maybe it felt that way. It feels that way to me, that you weren't taken seriously, that your story was minimized, that your feelings, your response to it was minimized, and it wasn't seen as being traumatic. And this is absolutely traumatic.
Yeah. Yeah. So there's something that happens that they talk about with like sexual assault trauma, which is secondary wounding. You probably know what I'm talking about. So that's what went on. And that can make things harder.
Yeah.
Sorry. I think it's just really important that people understand that, like, like certain messages, like, I don't believe you, or it's not that bad, can cause more trauma to victims.
Exactly. Yeah, make
any sort of trauma.
Right, shaming you. So what is your goal? What is your mission now?
Well, I just want to stop. I just want to, like, help prevent what happened to me from happening. And so I try to do that in a number of ways. Like, so one thing is I want, you know, patient education about vulvar anatomy to be improved. And just, you know, like, one thing I've done is I've tried to share information about the range of normal vulvar anatomy on my Instagram. I know that there are other activists doing that, and they do such a great job. Like, the Vulva Gallery is amazing. So that's one thing. Sorry?
You said the Vulva guy?
The Vulva Gallery is an Instagram account.
Okay, the Vulva Gallery.
Yeah, she draws vulvas. So she just has all different types of vulvas, and she's an amazing artist. So it's really cool. Wow. And it's a really big community.
That's on Instagram?
Yeah, she has over 500,000 followers.
Let's see. Found it. Got it. Yes. Okay.
Yeah, so it's great seeing that happening. And I want doctors to have better education in vulvar anatomy. I think this affects a number of things. Like, on Monday, I had a Zoom call with Jillian, who is a friend that I've connected with through my social media activism, and she was harmed in a biopsy, and she has also struggled with her health care providers, like, not really understanding her anatomy and not being able to help her. And I think that there are a lot of ways that patients could benefit from their doctors knowing better anatomy, and that it would improve patient safety in all procedures on vulvas, pretty much.
Yeah. And also, I'll say this to your point about clinicians not feeling comfortable discussing sex and genitalia and anatomy, and providers have to become more comfortable in discussing the body. I mean, you're a clinician, so
Yeah, I dissected clitorises with my dad. If I could be comfortable doing that, doctors can be comfortable
yeah,
talking to their patients.
I agree with you. I'm just looking at this lady's site.
Oh, Vulva Gallery. It's
Yeah,
awesome. I love it. Like something like that would have made such a difference for me at 17.
yeah. Well, that's the usefulness of social media now and all this technology we have. We can share a lot of information. Um, so
Yeah,
I
that's something. Yeah. Sure.
oh, go ahead, my dear. I'm sorry.
Oh, I just feel like social media is the fastest way to disseminate information, just in general. Like,
Absolutely. All right.
so
Do you have any last words for us, or you want to tell folks how to follow you on your Facebook, your social media, your
oh
efforts?
yeah. So I'm at Jessica_Ann_Pin, PIN, on Instagram, and I am MetaClit on Twitter. So like MEDI clit.
Oh, I think I have followed you on Twitter. I think I did come across that. Okay, good.
My latest tweets have been a little snarky. I just started being sarcastic, like saying that like penile anatomy should not be on WebMD because clitoral anatomy is not on WebMD.
Yeah, we need some equity here. We need to be treated equally. If we're going to talk about penises all the time, we need to be talking about the vulvas also. So,
Yeah.
all righty. Thank you so much for coming on. I appreciate you. Thank you for sharing your personal story. And, you know, I wanted to ask you this, but I wasn't sure if it was proper place. But um, have you found a workaround for yourself sexually so that you
Yeah,
can climax?
I have. So yeah, so I have experience. I mean, I have experimented with a lot of sex toys, and I do. I am able to orgasm. I stimulate.
Yay! Yeah,
Yeah.
isn't it
But
wonderful?
that's why I get so frustrated when people don't acknowledge that the clitoral body is external under the hood. So
Yes,
I have no sensation in the glands of my clitoris, but I have sensation at the base of the clitoral body, like at the top of the clitoral hood, and
yes,
that is how I orgasm. And
yeah. Gotta
so
get
when
to know.
people ignore that part of the clitoris, I get really nitpicky, and I'm like, make sure you show that.
Yes, yes, yes. All right. Perfecto. Thank you. I may. I'll contact you. I'll contact you a little later.
All right, okay.
Thank you so much for being on, Miss Jessica Penn. We appreciate you sharing your story. I hope ladies, women, share this with other women. Share this story. All righty. Everyone
All
have a
right.
good night. And yeah, the folks who've been watching, they've been very supportive. And um, let's see. Thank you for speaking up and speaking out. You're very brave for opening up about such a sensitive topic or subject. My sentiments.
Yeah.
All righty. Have a good night, everyone. And remember, brain love.